I'll have you a very good evening to you all. So today I'm going to discuss about protozoal and helminthic drug, or you can call it as anti-protozoal and anti-helminthic drugs. Now here, if you just take the last 5 years of NEET and AIMS, you will see that around 6 questions has been asked in the last 5 years. So you can't call it as a very important topic, nor you can ignore it. So what I'm going to do is I'm going to discuss a little bit of these areas, okay, of which you have got anti-protozoal and anti-helminthic. So protozoa are single-celled organism you studied in your high school, isn't it? Single-celled organism, whereas helminthics are the worms, which are multicellular. You can see it by your naked eye, whereas protozoa, amoeba, you can't see it with your naked eye, or plasmodium, which is, you can see there this malaria, causing malaria. You can't see it with your naked eye. So I'm going to discuss about, to start with, that is the anti-malarial drugs. I would say literally the most important among all. Okay, so this will be a little lengthy comparatively, and what I'll be discussing here about is in different headings. One is the life cycle of this one is the life cycle of this particular parasite, which is plasmodium. Then understanding the action of the drugs, so that is classification of the drugs. In one, like there is 2 types of classification. One is based on the action on where exactly it acts on the parasite or on the protozoa, okay. And the second one is the classification number 2. Now this is like one of the questions asked for you. Now, so that's why that classification is included. Some very important drugs to note, and finally drugs used in chemoprophylaxis specifically. So let's start the first one, which is the life cycle. I'll explain to you first the picture, then I'll explain to you what are the different stages. Just see the picture out there, where it has got a life cycle in the mosquito as well as in the human. So a mosquito comes and bites, that's where it starts. It enters into the bloodstream. From the bloodstream, it goes into the liver. From the liver, it again go back to the bloodstream, that is into the RBCs. Okay, and from the RBC, when the RBCs rupture, it gets back to the bloodstream. So you can think it like this: mosquito bites, bloodstream, liver, from liver to RBC, from RBC to the bloodstream. Again the mosquito bites, it takes that blood. Okay, here the bite is delivering it, here it is taking it away and being given to another person. Okay, so this is where the life cycle goes on. Okay, so let's understand this in a more descriptive sense, where I'm going to discuss about the the protozoa, which is plasmodium. You've got different plasmodium, vivax, falciparum, and so on. So based on that, the different types of malaria you get. Okay, I'm not going into that, but yes, if you just see, okay, a little, don't worry, it's not at all complicated. What happens here is the mosquito comes and bite the organism, the human. Okay, it goes into the human bloodstream. From there, it goes into the liver, and that is called the pre-erythrocytic. That is before entering into the erythrocyte, that is in the liver. So it's called pre-erythrocytic. Then it enters into the erythrocytes or RBC, which is called erythrocytic stage. From there, it goes back to the bloodstream, and from the bloodstream, it is taken away by the mosquito, and again it bites another person, and this cycle continues. So this is how the life cycle you have seen already. Now what happens here exactly? When a mosquito bites the human, it injects what is known as a sporozoid. So this is basically you can get a question like this: infective form of the plasmodium is sporozoid, because that is what is infecting. That is what the mosquito injects. So that sporozoid enters into the bloodstream because the mosquito have bited it. Now in the bloodstream, okay, this sporozoid circulates and then reaches the liver, as I told you already, and it begins something known as the pre-erythrocytic, that is in the liver stage. Okay, now here there are 2 things to note. The primary development of this particular organism takes place in the liver. Now, if you can't prevent here, now very important, okay, if you can prevent the organism here, the primary development is prevented, you will see what is going to happen. Okay, so the primary development takes place in the liver. Now here, 2 things happen. You already saw that sporozoid coming to the liver. This sporozoid further develops, I told you the primary development, so further develops into merozoite. So whatever is there now, it's a merozoite. This merozoite goes into the RBC. Okay, so what you saw, sporozoite from the mosquito into the bloodstream, into the liver, primary development into merozoite. Now the merozoite goes into the RBC. From the RBC, it goes into the bloodstream. Okay, so that is what is happening now. So you got erythrocytic and pre-erythrocytic. Now, in the bloodstream, this further develops into something known as gametozoid. Now, this is where the reproductive phase. Okay, the other ones are not reproductive. This is what is reproductive. The male-female gametes combine to form the zygote and so on. So this occurs in the bloodstream, the gametozoid. Okay, now this gametozoid is being taken by the mosquito. The mosquito bites you, it takes this gametozoid, okay, and this gametozoid is then further becomes the sporozoid and the cycle continues. So this is where it all started, sporozoid. So if you can, prevent this, or if you can kill this, it can prevent transmission, isn't it? It can prevent the transmission to the next person. You're killing it here. Okay, because then the mosquito cannot take this gametozoid and you can do this. Okay, so these are the phases. Now, one thing I just want to critically note here is the symptoms of malaria. What are they? Fever, chills, rigors, whatever. It corresponds to the erythrocytic stage. Now, we saw the development is in the primary development is in the pre-erythrocytic, that is liver, whereas symptoms is due to in the erythrocytic stage. Now, if you can kill this in this stage, kill the plasmodium in this stage, you are preventing the clinical manifestation, isn't it? So, because the fever chills corresponds to the erythrocytic stage. Hope you got a basic idea. Okay, if not, review it and see, watch it again. If a little confusing area, but yes, it's once you understand it, it's not a problem. So that's different stages. Now, understanding the action of drugs. Now, here also you have to understand the pre-erythrocytic stage, erythrocytic stage, okay, gametocyte, we saw this, the reproductive, then exoerythrocytic, I'll tell you what it is. So, you know what is pre-erythrocytic in the liver, okay. So, what is schizogony? Basically, schizon, I'm not going into too much of details of this, but schizon means a liver cell or a RBC. It can be either a liver cell or an RBC, okay, which is where the development or the infected organism is there. That's called schizont. Okay, means to say a normal liver cell is called what? Hepatocyte. Now, if the parasite enters and infects the hepatocyte, it's called a schizont. It's called a liver schizont. Now, normal RBC is called what? Erythrocyte. Now, the parasite enters into the RBC or erythrocyte, it's called RBC schizont. Okay, so this life cycle corresponding to that particular phase is called schizogony. Okay, simple. So, you can have a pre-erythrocytic schizogony in the liver or erythrocytic schizogony in the RBC. Now, let's understand the drugs. Okay, now why this is being said is, if you target this stage, we can target a particular phase. As I told you, in the liver, the primary development takes place. So you can prevent the primary development itself. Okay. If you're targeting at this phase, you can prevent the manifestations. Okay. And like I told you, the gametocyte, which is in the bloodstream. So if you can do this, you can prevent the transmission. Okay. There's one more stage, I'll come to that. So in the liver, that is pre-erythrocytic schizogony, there are certain drugs we have to know, and what is the purpose of this drug, or what is the use of this drugs. Okay, if you use it at this stage, what is the effect you can have. So the examples of drugs which acts in the liver or pre-erythrocytic stages: proguanil, okay, you have heard of it, primaquine, pyrimethamine, 3 drugs, okay, proguanil, primaquine and pyrimethamine, 3 drugs. What are they used for? They used for causal prophylaxis. What is that? That is, stops the disease before it starts. So basically, I told you, in the liver, the primary development takes place. So if you don't allow this virus or this protozoa to develop, you can stop the disease before it starts. That's called causal prophylaxis. So they can ask you, the drug used for causal prophylaxis is what? Either of these 3: proguanil, primaquine, pyrimethamine. Or the drug which acts in the liver is which one? Okay, so this is the 3 drugs you get there. Okay, now going further, so you got 3 drugs out there: proguanil, primaquine, pyrimethamine. Now in the erythrocyte, that is in the RBC, the same thing which is happening. We're going to see the examples. A little more is there. So here you have to remember a thing which is called fast acting and slow acting drugs are there. Here there is no such things. Okay, just 3 drugs. So you've got fast acting drugs and slow acting drugs, which is targeting the RBC or the RBC schizont. Okay, now the fast acting drug you can remember, or you should remember, in mnemonics called machar. You know machar means what in Hindi? It's for South Indians, it's called the mosquito. Okay, though spelling is not very correct, it's called machar. Okay, so M, that's fast acting. Okay, M is for mefloquine. Okay, mefloquine. A is for, okay, there is one more A there, it's not 2 A's. Okay, let's remove that. So it's, what is it? It's called atovaquone. Okay, not quin, cone or whatever, atovaquone, or you can call it as atavocone. So how are you spell it? Q is for very familiar quinine. Okay, and CH is for chloroquine, and AR is called artemisinin. So what are these? Mefloquine, atavocone, quinine, chloroquine, artemisinin. Now, how to learn this? Every day morning you have to revise the classification till you learn it. It's a key. It's not sitting today and learn by hacking, mugging up. No, it doesn't happen like that. It will not register. Instead, what you have to do is you have to do it today. Definitely write it down. Okay. Tomorrow, take this before starting your next topic. Take this, review this. Now, pharmacology, every day you have to do 20 minutes revision. Okay, pharmacology, every day 20 minutes revision is mandatory. And whatever you have learned the previous day, you should do. Okay, no doubt. And continue every topic. Like for example, yesterday's topic 20 minutes, the previous topics 20 minutes. Okay, if you don't do that, it will not work out there. So unless and until you don't follow this method, it becomes very difficult to learn the pharmacology effectively. Okay, so every day 20 minutes is mandatory. So that was fast acting drugs which acts on RBC, targets RBC. Now you've got slow acting drugs which is proguanil, pyrimethamine. So these are familiar. The same here, proguanil, pyrimethamine, which targeted liver also. Okay, so that's one thing which is similarity. Then you have got sulfonamides, the antibiotics, and definitely another antibiotic which is tetracycline, both of which can be used to target the RBC. So those are 2 first drugs which is used in the liver, okay, except proguanil and pyrimethamine, first and third, okay. So proguanil and pyrimethamine, then sulfonamides and tetracycline. These are the slow acting drugs. Now, where are they used? Understandably, we said in RBC is what happens. That is responsible for all the manifestations. So you can treat the acute attacks, okay, or you can call it as clinical cure. The clinical manifestations can be cured or prevented. Okay. Now you can use it for suppressive prophylaxis. That is, again, the same thing, other name. Previously we said causal prophylaxis. Okay, if it's in the liver, causal prophylaxis because stops the disease before it starts, because the development is stopped there. Here the clinical manifestation stops, so it's called suppressive, suppressing the clinical symptoms, preventing the clinical manifestation. So that is about in the RBC. Now, if you go to the next, that is the gametocyte, the gamete, which is in the bloodstream. So here there are certain drugs which you can use. The example is called chloroquine and quinine. So it's very common things are there. Okay, chloroquine and quinine is here, the fast acting. Okay, so it's common. Now here proguanil, pyrimethamine, same which belongs to the liver. Then in gametocyte, the chloroquine and quinine. Okay, so there are similarities, chloroquine and quinine. So if you use here, it prevents transmission because this is what is being taken by the mosquito. I told you. Okay, this is taken by the mosquito. Now, finally, exoerythrocytic. Okay, that is outside the erythrocyte, but that means what? Liver. So some schizons, some of these parasites remain dormant in the liver rather than spreading from liver into the RBC then to the bloodstream. They remain there. And what happens? It causes relapse. It doesn't spread, but you know the development takes place there. So it causes the relapse. So if you can target here, you're using what? You're doing what? You're causing a radical cure. Means what? Completely eradicate. There is no dormancy. You completely eradicate the organism. The example of this drug is primaquine. Okay, primaquine, again something which we studied here, that is primaquine. So once again, proguanyl primaquine, which is targeted in the liver, which is same as the slow acting in the RBC. Okay, proguanyl pyrimethamine. Okay, then quinine and chloroquine, which is fast acting. You can at least learn this much. Quinine and chloroquine, which is the fast acting in RBC, they are the ones which is in the gametocyte, killing in the gametocyte, chloroquine, quinine. And yes, primaquine, which was there again in the liver, the between one, which can be used to kill the organism in the exoerythrocytic state. So now see, this one, if you know this classification, it's good. At least, as I've told you, at least know proguanyl pyrimethamine, you know it now. Primaquine, so you have seen this again. Again, you go to this organism, quinine, chloroquine, or remember the this thing that is pneumonics, machar in the RBC, fast acting, slow acting, proguanyl pyrimethamine at least. And other two are antibiotics, you are very familiar with them. Then you go for the next one, which is chloroquine, quinine, again the same thing which we learned here, connection. Then the same thing again, primaquine in the exoerythrocytic. So it's not a big problem, but yes, first go, it might feel a little problematic. Now, another classification which is given in your book is about the chemical composition. The other one was where exactly it's used, which stage it's used. So one question was asked for you, which of the following is, so in APG 15, which of the following is an 4-aminoquinolone? 4 aminoquinolones. So there are 4 aminoquinolones and 8 aminoquinolones. There are two types, 4 and 8. Okay. In between, which belongs to this 4 aminoquinolone, there is this thing called 4-quinolone methanol. So it belongs to this again 4 aminoquinolone, which is 4-quinolone methanol. Okay, 4-quinolone methanol. This is 8 aminoquinolone. Finally, cinchona alkaloids. Okay, if you don't learn that, at least know these three. Okay. Now, what are the drugs which comes under the 4 aminoquinolones? It's chloroquine. Okay, we studied this. Okay, which is the fast acting. Also, you need to know which is known as amodiquine. Okay, very strange names. Amodiquine, which was asked. So chloroquine related as amodiquine and piperaquine. Okay, so chloroquine, amodiquine, again. Revision is the key. Repeat. Okay. So the orange one indicates that which was there in the option. Which of all of the following are 4 aminoquinolones except. So these two were there in the option. Chloroquine and amodiquine was there. Then you have got to write it down. Once you write it down, it stays there. Next, you have got 4-quinolin methanol, which is also belongs to the same class. So this was also there in the option, which is mefloquine. Okay. So these three were in the option, all of which are 4 aminoquinolones. Then one which was there in the option, which is the answer, that is answer of exception, 8 aminoquinolone, which is primaquine. So where did we study primaquine? Exoerythrocytic, isn't it? Primaquine, exoerythrocytic stage. Plus we also studied it in the liver. Okay, the one which acts in the liver. So primaquine is basically 8 aminoquinolone. Again, you might feel it's a little complicated, but once you revise, it's fine. Now, just for the completion's sake, I just included tefenoquine. But at least you know these 4 drugs, it's sufficient. 4 aminoquinolones, chloroquine, amodiquine, mefloquine. 8 aminoquinolones, primaquine. Now, just cinchona alkaloids, quinine and quinidine. So that's just to remove that confusion. Chloroquine, amidoquine, quin. This is quinine and quinidine, which is cinchona alkaloids. So hopefully you're writing it, you're learning it. It's very good. Now, some important drugs to note. This is another area where you got questions. In fact, this is the area where you majorly got questions other than I just told you here. Okay. Now, having understood the life cycle, having understood the drugs, where do they act, we're going to see some very specific drugs. Okay. Especially in the region of liver where it acts, the drug very important is primaquine. Okay. The center drug, primaquine. Then there is another drug which is very, very important is pyrimethamine. Okay, small knowledge of it is required. All these maroon ones. Okay. Then in the region of RBC where it acts, we need to understand that is fast acting drugs, quinine and chloroquine. Okay, and then when we come down, we studied classification number 2, where we have studied that 4 aminoquinolones. We have got 4 quinolmethanol, okay, or quinoline methanol. So in that we have a drug called mefloquine, okay, and one more drug I'll tell you, which is not studied so far. So let's come to the pre-erythrocytic schizogony we studied in liver. The drugs, which examples are proguanil, primaquine, pyrimethamine. So in that, I want to teach you about a little bit on primaquine, okay, the second drug, where 2 things which you have to note, must note. Primaquine is contraindicated in pregnancy. You can't use primaquine in pregnancy. Okay. Now, yes, what is a drug then used in pregnancy? This is asked for you in 2021. What is a drug of choice which you can use in pregnancy? Okay, that is quinine and clindamycin. Okay, so what we are doing? Why are we using these drugs? Okay, why are we using the drugs in the liver case or in the liver? That is the causal prophylaxis, stops the disease before it starts. Okay, so yes, you can use it, but not used in pregnancy, primaquine. Instead, you have to use the drug which is quinine, clindamycin, or chloroquine or artemisinin. Very, very importantly, quinine and clindamycin. Okay, we're coming to quinine, which is a fast-acting drug here. Okay, and chloroquine also we are coming to, but yes, here, yes, we are not using primaquine in pregnancy, and there is a very, very problematic situation which is related to the primaquine, which you have to very must understand, is that it causes hemolysis. One of the very serious adverse effect of this primaquine is it causes hemolysis in patients with glucose 6-phosphate deficiency. Okay, or glucose 6-phosphate dehydrogenase deficiency. Now, where is this enzyme actually seen? In biochemistry, when you're going to learn the pentose phosphate pathway, you will come across this enzyme, okay, in pentose phosphate pathway. Okay, so please note, primaquine is not used in pregnancy, complicated. And another thing very important to notice, it causes hemolysis in glucose 6-phosphate dehydrogenase deficiency patient, thereby leading to what? Hemolytic anemia. Okay, now yes, it's you asked in 2001 and 2012, it was repeated. Okay, now that is the first drug, which is primaquine. Then we studied another drug which is related to liver, we can use, which is pyrimethamine. One more just point which you have to know here is it's a drug of choice in toxoplasmosis. So this the malaria is one of the organism or one of the disease caused by the plasmodium. Similarly, you've got another protozoal disease which is called toxoplasmosis, caused by toxoplasma. So you have to know that this pyrimethamine is a drug of choice. Okay, 2 things, primaquine and pyrimethamine. Okay, primaquine, very important, contraindicated in pregnancy. Very important adverse effect is hemolysis and G6P deficiency. Now coming to the machar, which was the fast-acting 2 drugs, as I've told you, quinine and chloroquine, very much related. In quinine, what you have to know here is, now this is important, that is the drug of choice. Now quinine is a drug of choice in falciparum malaria resistant to chloroquine. Now we are going to come to chloroquine first to understand. What we studied, this quinine is a drug of choice in falciparum malaria resistant to chloroquine. What does it mean? Chloroquine is used to treat falciparum malaria, but some falciparum malaria are resistant to chloroquine. So in that case, you're using quinine. Now here, I just want to add chloroquine before I go to the quinine. Please note. Okay. Now, what is now here? In chloroquine, you also understand it's a very important drug. It's one of the very commonly used drug for treatment. Okay. And when this doesn't affect, you use quinine. Okay, that was I was saying. So you have to know a little bit on metabolism. That is, it has got the largest volume of distribution. It gets distributed throughout the tissue. Okay, you studied volume of distribution in the general pharmacology chapter. So this, among the anti-malarial drugs, chloroquine has got the largest volume of distribution. Now these are the drug of choice for treatment and prophylaxis of non-falciparum malaria, and in some malaria where falciparum is sensitive. If it is not sensitive, you go for, yes, quinine. Okay, there's a small controversy, that's why there's a question mark, I'll come to that. So, treatment and prophylaxis of all those were non-falciparum. In falciparum malaria, either some are sensitive to chloroquine, some are not sensitive, you've got quinine, yes, other options also. Okay, now adverse effect, very, very important. It causes this chloroquine machar, okay, among the machar, it causes retinal damage. Okay, retinal damage, and then finally leading to blindness. And what is it called? Bull's eye maculopathy. If you can learn it, it's very good. If you can't learn it, just forget it. Okay, now at least you should must know certain things which I'll be repeating for you. One is this one. Okay, primaquine, contraindicated in pregnancy. In that, quinine clindamycin you use, or chloroquine. We are studying quinine and chloroquine now, isn't it? This one. These are the other options: quinine, chloroquine. Okay, so quinine along with chloroquine, you have to use clindamycin or chloroquine in itself, or artemisinin. Okay, now, so that was about the chloroquine. Now, if you come to quinine, as I've told you, it's a drug of choice when the falciparum malaria is resistant to chloroquine. You can use quinine. Now, this description is given in Sparshgupta. Okay, this is there only in Sparshgupta. Now, one of your question which was asked for your NEET MDS, it had an option which called a quinine, but the actual answer given was this one. Okay, atavaconin plus proguanil combined. So I searched in different books. So some standard references said that quinine along with doxycycline is a third option. It's not the drug of choice. Okay, though it is saying in your Sparshgupta it's a drug of choice for falciparum malaria resistant to chloroquine. The first drug is AP. You call it as AP. Okay, atavaconin and proguanil. And this was the question asked to you. The first option drug asked to you in 2017. Okay, second option you've got AL, that is artemether lumefantrin. AL. This is the second option. Third option is quinine when combined with doxycycline. So you must know. Okay, that is chloroquine is used in non-falciparum malaria as well as chloroquine sensitive. If it is not sensitive, the first drug is atavaconin proguanil. The third choice is quinine with doxycycline. Okay, and very importantly, the adverse effect is hypoglycemia. So chloroquine, the adverse effect is retinal damage. The quinine, the adverse effect is hypoglycemia. Now, when it came to primaquine, okay, the first drug which is in the liver, the second drug in the liver, the adverse effect is G6PD, which is contraindicated in the pregnancy. Okay, so you studied the three drugs very importantly. One was, or in fact 4 drugs. One was primaquine, okay, which is the liver. Then you've got pyrimethamine, again in the liver. Then fast-acting machar, 2 drugs, quinine and chloroquine. Chloroquine is a major drug. Quinine, when it's not, or which is not sensitive or which is resistant, use quinine. But more importantly, you've got this AP. Okay, but very importantly, quinine has got adverse effect of hypoglycemia. Chloroquine has got the retinal damage and blindness. Okay, so okay, then short-acting, there is no specific drugs which you have to know. Okay, it will be sufficient to know whatever we have learned. Yeah, one area we studied 4 aminochloroquines, 4 aminoquinolones and 4 quinolomethanol. Okay, and 8 amino, which was the one we said primaquine. Okay, we just studied now, isn't it? We studied primaquine just now. So yes, let's come to mefloquine, which is another drug which you have to know. Okay, one thing is the use of it, another is adverse effect. Now, effective as a single dose. Now, mefloquine, all other drugs we saw, you have to use multiple doses. Mefloquine is one drug which you just need single dose for treatment. Another thing is the adverse effect. Okay, very important. Ask for you. Adverse effect of mefloquine. You remember madness, psychosis. M for madness, M for psychosis. Okay, mefloquine, neuropsychiatric disorders or psychosis, very important. Okay, neuropsychiatric disorders, and thus it's not given to pilots or those handling machinery. So one of the questions asked for you, all of the following are correct except. So it's given in pilots or something like that was the question. So it's not given. The mefloquine, M, madness, psychosis is not given in pilots because it causes the neuropsychiatric, and if it's effective in single dose, but the problem is this. Okay, so these are the drugs individually you have to know. One more, so you studied about chloroquine. Okay, what all did you study? Just one quick review. Chloroquine. Okay, I don't want you to disturb the order. Anyway, let's see. What did you study? The metabolism, one of the very important drugs, chloroquine. Okay, drug of choice in non-falciparum and sensitive falciparum. The problem was retinal damage. Then we studied quinine. Okay, we studied that. It's a drug of choice, in fact, as per Sparshgupta, but AP. Okay, then we studied mefloquine, isn't it? The madness drug. Okay, so single dose, very important. Psychosis. Then, yeah, before that we studied the first, that is category 1, that is the liver. We studied about primaquine, which is contraindicated in pregnancy, okay, where yes, you use the quinine clindamycin combination, chloroquine. So this is just a review. You don't need to write it again. Your photographic memory should be based on the previous one. Okay. Now pyrimethamine also we studied, drug of choice in toxoplasmosis. Now one thing we didn't study was halofanterin. Just one thing you have to know, that is asked for you, that is the cardiotoxicity of halofanterin. Okay. Now it creates a halo in the heart, or a hole in the heart. Remember it like that. Halofanterin, cardiotoxicity, that is it prolongs QT interval and causes dysrhythmia. That is the ECG, the QT interval is prolonged and your rhythm of the heart is being affected, causing dysrhythmia or arrhythmia. This was asked again 2001. Okay, so this is all about these drugs. Okay, don't forget the order, though I've just reviewed in a different order for this time, but yes, please note that it was primaquine we started, which is contraindicated in pregnancy, and we have the quinine, which was the option there. Hemolysis and D6PD. Then quinine was the next drug, which we said the drug in pregnancy. Along with chloroquine, you can also learn artemisinin. So quinine is the next drug we are studying. But before that, we have to understand chloroquine so that we understand quinine better, because chloroquine is a drug of choice in the falciparum, non-falciparum and falciparum. But if it is not sensitive to chloroquine, you can use quinine as a third drug, but first one is AP. So if you can connect like this, it becomes very easy. So that was about your chloroquine and quinine. Then we studied was our mefloquine, which was the madness drug, which is a psychosis problem. Then halo, causing hole in the heart. Just remember, okay, it's actually not causing hole in the heart. It's causing cardiotoxicity, prolonging QT interval. Okay. Now, yes, drugs in chemoprophylaxis. So we studied what all prophylaxis. We studied some prophylaxis related to different things. Okay. We studied that if you're using it in the pre-erythrocytic, that is in the liver stage, you can use it for causal prophylaxis. Means a patient got the disease. Okay, for example, he has got the disease. Now you have to just stop the disease from starting, because it is in the liver the primary development takes place. So you have to stop then and there. Okay, so in that case, you are using it for causal prophylaxis, stop the disease before it starts. Okay, in simplest of terms. So that is called causal prophylaxis. Now we studied, if it's in the RBC, what we're doing, what is the effect you're doing? It's a suppressive prophylaxis. Now you're going to study chemoprophylaxis, where you just those are not affected. Okay, you are preventing the disease to be originating itself. So you can have two options here. You can use the drug for short-term purpose, less than 6 weeks, and there are drugs which is used for long-term purpose, more than 6 weeks. For less than 6 weeks, doxycycline, the tetracycline is the drugs of choice, and mefloquine is if you're using it for very longer period. So yes, by that I'll come the end of this thing, but I know that it's a little complicated area, okay, a little problematic area, but yes, I want you to revise it every day morning, multiple times if possible, or at least once every day morning, tomorrow, day after tomorrow, till it enters. Okay, and pharmacology has to be revised every day. Just got a message from a student saying that, sir, I studied everything for AIIMS, now I forgot everything. Now see, it's okay, you forgot everything, fine. You still have what? 2 more rounds to do all this. At least 3 more rounds. And every day you're revising. And here's the best part of the exam, NEET or INI-CET, is that you study everything. The next day you are about to forget. So you have to come back again. Okay, and do it again. So that's the only way out there. Okay, so thank you so much. I'll stop this session here. We'll start next anti-protozoal drug in the next session. So this is a very long session. The next all will be combined in one session. Okay.